Hello, everybody. It's Tuesday night. It's 7 o'clock, and we are live. Hello, everybody. It's Tuesday night. It's 7 o'clock, and we are live. Welcome to Detox. I'm your host, Veronica Brockwell. Well, it's the last Tuesday of the month, and you know what that means. We have our favorite doctor on the Detox. He is a chiropractic physician, a functional medicine practitioner, a certified cellular inflammation and detoxification specialist, and he is my very dear friend. Please welcome to the Detox, Dr. Michael Wild and his dog, Ralphie.
There he is.
There he is.
I'm pretty sure he's actually attached to my body.
How are you, my friend?
I'm doing great. And look, Ralphie is just, he's like, looks at you with these loving eyes. I don't mind holding him all day.
He's adorable. I so look forward to seeing him every month. Can I see his face? Can you put his face?
Well, that's a good question because he needs a haircut.
I know, right? Well, I have a stuffy dog too.
There he is.
Oh, there he is. What kind of dog is Ralphie?
He's a Havapoo, half Havanese, half poodle.
Oh, well, he's very, very cute.
And a Havanese is kind of like a Pekingese. I'd never heard of them, or Maltese. I never heard of them before I found him.
Really?
But, yeah. They're from Havana, so Havanese.
Okay. Well, he's adorable, and we're glad to have him week after week.
Yes.
So, what is our topic this evening, Dr.
Well,
Wild?
I'm excited to be talking at all because, looking back, we actually haven't done this, I think, since October.
No.
So, yeah, believe it or not, because of the holidays. I look back. It was either October or November, but because of the holidays, and then we had technical difficulties, and then family emergencies, and one thing after another.
What's up with that?
Right. So.
Okay. Well, hey, how was the holidays?
The holidays are great for me. I really, really enjoyed them. I really had some really good times visiting family and friends over the holidays. How about you?
It's been wonderful and amazing. So, yeah, thank you for asking.
It's funny actually, because now that you say that, one thing that I do over the holidays, you probably do too, if you're a human, is you kind of go off the reservation a little bit with what you would normally eat, what you would normally drink, right? We probably stress our immune systems by staying up too late and doing different things. Well, the interesting thing about that is tonight's topic is all about autoimmunity.
Yes.
And we're going to discuss what that means, what some common autoimmune conditions are, what the common treatments are for them, what we might want to do instead, that kind of stuff. But just very simply put, over the holidays, I had a little flare up of my own autoimmune condition, which is a very, very common one that most people have no clue is even autoimmune, and it's called eczema.
Oh,
right?
yeah.
So eczema is a skin condition where your skin gets dry, it gets itchy, right? You get these little red patches, and it's actually a skin condition, and there are many autoimmune skin conditions. We'll talk specifically about some of those tonight. But the reason that got flared up was because I went off the reservation with what I was supposed to be normally eating to maintain a healthier GI tract. So we're going to talk tonight about how that's connected and why what you eat is intimately involved with autoimmunity.
Well, I look forward to it because I have a few little skin things that happen to me as well. So I'm very curious as to what you think is causing those. So I guess let's just first start, what is autoimmunity?
All right. Well, that's not as easily answered as you might think.
Okay.
And the reason I say that is we kind of all agree on what autoimmunity is in effect, but we don't agree on what the causes are, right? Mm-hmm. So in effect, autoimmunity is when your own immune system attacks healthy cells as if they were foreign cells, right? So for some reason, your immune system gets confused. So the reason I said we're not sure about the causes of that is some people believe that the immune system would never actually attack your own tissue, that it simply is not a good, course of action for survival. So why would your body do it? Yeah. So there are those who believe that there are actually perhaps hidden viruses or parasites or things that are affecting cells that we can't actually see, maybe just because we don't have the technology or we're not looking in the right places. And the immune system is actually attacking that. And that might be true. We don't really have a way of knowing that for sure, but we do know that the immune system seems to get overstimulated and attack its own tissues. And that can come out as over 150 different disorders that we call autoimmune diseases. And we're certainly not going to cover all those tonight, but I'm going to list some of the most common ones because people often don't realize that they are even dealing with an autoimmune disease. So, from my past talks with you, everyone might already know that for a large portion of my life, I had a lot of GI problems, right? I suffered from irritable bowel syndrome. That came out in many different ways, some of which I'd rather not talk about right now. Yeah. But one way that came out was through my skin.
Okay.
Right? Because your skin on the outside of your body is the same as the tissue on your inside of your body, right? So if you just followed your skin up and around and into your mouth, the tissue on the inside is the same as on the outside, right? That's actually skin in there too. And that goes down and becomes your digestive tract. And so the digestive tract is the inside of the same tissue that you're seeing on the outside. So when you have inflammation of your GI system, it almost always shows up on your skin in some way, either as a rash, blisters, bumps, sometimes bleeding even. So there's a lot of different ways that can show itself. So we use a saying that the skin is the window to the digestive system or the intestinal tract. Okay. So those two are intimately connected, which is why when I went off the reservation and I said, sure, you made that special holiday dessert. Who am I to be rude and turn that away? I should absolutely have a piece of that. And we're going to someone else's house and they're telling me the same thing. And then we're going over here tomorrow. So I allow myself to go a little bit off the reservation around the holidays and around my birthday because, you do the right thing 90% of the time so that you can cheat 10% of the time. That's part of being alive, right?
Right.
So, my motto is always 90% of the time, do what's right for your cells. So 10% of the time, you can do what's right for your soul, right? Well, that all sounds good in theory until you do it. And then you feel like complete crap following that because your body doesn't forget that those things were not good for you, right? And I've worked very hard to repair my body, but there are certain weak links that were there my entire life. So if I do enough of the wrong thing, I can get it angry, right? I can start to bring it back to life when I really shouldn't. But then thankfully, I know how to very quickly shut it back down, right? So I ate and drank and was merry, but then everything started to flare up. I said, okay, idiot, you did it again. And I got back on track. And within a couple of days to about a week, it was all back under control.
Wow.
It was gone again. So I know what to do. Doesn't really give me license to go off the reservation, but sometimes it happens.
And what did you experience with your skin when this happened?
So for me, it was mainly a flare up of that eczema, right? So I get dry, itchy, scaly patches. I get them in the corner of my eyes. I get them on my elbows. I get them on my knees, right?
Okay.
So when I look down, I'm like, oh, there's that patch on my knee. I know what's coming, right? Then I'm going to get these and they burn in here. It's really kind of irritating. They're not huge or anything. No one else might even notice them, but I know they're there because it feels like I have salt in my eyes, right?
Yeah. I get that around like under my nose, like,
that's another common spot is under here.
So that's eczema when it shows up.
What's that?
I've had it here and under my nose before.
Yeah. So it can really show up anywhere, but those are some of the more common areas of that. So eczema is an autoimmune condition, right?
Okay.
As is other skin conditions like psoriasis, right? I'm going to use my little cheat sheet here because there's so many. I'm just going to read off some of them, right?
I know we didn't list them.
About common skin conditions. Let's go back. All right. We have Behçet's disease, and Behçet's disease is nasty. One of my best friend's brothers has Behçet's disease, and that's a disease where your immune system attacks your blood vessels. And it comes out in form of lots of inflammation. And actually bleeding, like spontaneous bleeding from your skin, from your eyes, a lot of really bad mouth sores.
Oh my
And your mouth
goodness.
can bleed. It's nasty. It's really bad.
Sure.
It kind of tears you up. Then there's something called dermatitis, and there's very specific forms of that, like dermatitis herpetiformis, dermatomyositis, which affects both your skin and your muscles, right? Lichen planus, where the skin gets really thick and leathery. Linear IgA disease. IgA is an antibody found in, guess where? Your GI tract.
Right.
And so when that gets inflamed and you start making that inappropriate amount of what we call secretory IgA antibody, it comes out as a disorder of your skin. We have lupus. Lupus in and of itself is an autoimmune condition that affects your organs and glands and connective tissues, but also can affect your skin. So there's lupus of the skin. There's also scleroderma, pemphigoid, pemphigus, very similar things. Vasculitis, inflammation of your blood vessels. That's not Behçet's disease. So it goes on and on, right? Well, what are some more of the more common ones that we deal with? Well, we talked about eczema. How about asthma? Asthma is autoimmune.
We were just having this conversation because my little Chihuahua has asthma.
Right. Right. So maybe we need to check the Chihuahua's diet.
Yeah.
And look at what's happening to her intestinal system that might be related to that. And just out of curiosity, has she ever had antibiotics for any reason?
Not recently.
Like ever?
I mean, I think, yes.
Okay.
Yes.
And the reason I ask that, it doesn't have to be recent, but in the case of a human being, if you have antibiotics before the age of 1, which is common for a lot of ear infections for kids, it increases your risk of developing asthma by 300%.
You know what?
Yeah.
She was getting ear infections. She has been on antibiotics actually recently for a bit of time because she kept getting ear infections.
Okay, look at that, right?
Oh my goodness.
So little Chihuahuas are not so different than us.
Okay.
So the reason that happens is when you take antibiotics, as we've discussed in some of our previous episodes, it really just disrupts the balance of the organisms that live in your gut called your microbiome. And that microbiome controls 90% of your entire immune function for your entire body. So if that immune system is getting kicked up, it's going to affect different tissues. And your lungs have their own microbiome. Your skin has its own microbiome. Your genitals do, your sinus does, and they're all in balance with each other. So if antibiotics wreck your gut microbiome, it's going to come out and affect the other microbiomes, which in turn affects the function of those areas. And if it's in the lungs, you can develop asthma.
Okay.
Right.
We're gonna have to talk about this later.
And because it also affects the sinus microbiome, it also affects allergies. So allergies can be another autoimmune dysfunction. All right. Then some of the more common ones, the bigger ones, are rheumatoid arthritis.
Okay. Yeah.
Right. Where your joints are basically eating themselves and they tend to get disfigured and you get the fingers that are crooked, kind of thing. Lupus, as we said before, celiac disease. And that is an inflammatory condition of the gut where you cannot tolerate wheat proteins, right? And gluten specifically, because it actually causes your gut to become so inflamed that it breaks the tissue down and your gut starts to disintegrate. And then you can't absorb nutrients. And people with true celiac disease can die from that, right? So a lot of people who think they have celiac disease don't actually have true celiac disease. They have something we call gluten sensitivity. And that can cause a lot of gastric upset and a lot of other health-related problems and even skin rashes, right? But they're not going to die from it. They might wish they were, but they're not going to die from it, okay? Something else called Sjögren's syndrome, right? Which is a disorder characterized by really dry eyes and dry mouth. Then we also have things like MS, multiple sclerosis, all right? Polymyalgia rheumatica. That's when all your joints become inflamed and you get muscle pain and stiffness, and particularly in your shoulders and your hips. It's also been called polymyositis, all right? So this is inflammation of the muscles, particularly the shoulders and hips. Those people tend to weaken in those muscles and their core, and they start to hunch forward, have a hard time sitting up by themselves eventually, being ambulatory and walking can be a big problem. We also can have something called ankylosing spondylitis, which is where your spinal joints start to fuse into each other. So you become rigid and stiff and you can't move, right? A very common autoimmune disorder, type 1 diabetes, right? Now I say very common just because of diabetes. Actually, type 2 is much more common. And that's when you brought it upon yourself because of the diet that we're eating and because of toxins and other inflammatory chemicals in the environment affecting our cells' receptors. And I know we talked a little bit about that in the past too. You can also lose all your hair in patches called alopecia, right? And like big chunks can start disappearing. As we said before, vasculitis, you can have temporal arteritis, which is where just particularly the arteries in the temples for some reason get targeted. And that can cause lots of bad headaches, right? All around the scalp. So those are just some of the more common ones, right? But another one that people don't think about often is hypothyroidism, particularly a kind of hypothyroidism called Hashimoto's thyroiditis, which is an autoimmune-driven hypothyroidism, which is actually about 80% of all hypothyroid cases, and they just haven't been diagnosed properly, right? But when you do the right tests and look at the right particular fully comprehensive thyroid panels, not just TSH or T3 and T4, is really about 12 to 14 markers you need to look at. When you do that, then this reveals itself and you know how to treat it differently. Let me see if there's anything else that I didn't mention. Oh, I said before, like IBS for myself, right. That's an autoimmune disorder, right? Yeah. And that's kind of what started my whole eczema issue, was my years of gastric distress that I had from what I can remember, at least from high school all the way through to graduate school.
Wow.
Right. So at least 8 years of that, you know. Another one that you may have heard a little bit about related to things like flu shots is Guillain-Barré syndrome.
Yes.
Have you ever heard of that? Right.
Yes. I have a friend who struggles with that. Yeah.
So that's a disorder that you can get after, well, we know for a fact it can come after a vaccination, right? So, because that vaccination can cause a sudden immune flare-up because it's trying to stimulate your immune system. That's what the whole point is. But your body may not take kindly to that. And it can trigger an autoimmune disorder called Guillain-Barré syndrome, which attacks your nerves, controlling the muscles of your legs particularly. So you can end up with paralysis. It can affect your upper arms. You can have severe weakness. Another very similar kind of disorder is called chronic inflammatory demyelinating polyneuropathy, CIDP for short, right? Very similar to Guillain-Barré. It affects the nerves, but the symptoms last much longer. Guillain-Barré can be short-lived. CIPD is very long-lived, and it can actually kill some people because it can affect the ability of the diaphragm to work. So you stop breathing, wow. Right? And not to get us canceled right away, but it's not only the flu vaccine that can cause it, if you catch my drift. Okay, so I've seen multiple cases of this in the recent couple of years, much more so than before. Okay,
we can't talk about it.
Scientific fact. Okay, but anyway, that doesn't seem to matter. All right.
You know what'll happen? We'll get shut down.
I'm not going there. I never said that.
Don't go there. We'll get shut down. You know what they do to us.
I didn't say that. You didn't say that.
Okay.
Okay.
All right.
Besides the Hashimoto's, there's another thyroid condition called Graves' disease, right? And that's when your body produces antibodies like Hashimoto's against your own thyroid gland. With Graves' disease, you tend to have the bulging eyes kind of thing. You may have seen some people like that, right? So that can be a very destructive disorder as well. It causes your hair to fall out. You can have brittle nails. You can have problems with your weight, irritability, brain fog, difficulty sleeping, all kinds of fun stuff can come about from that, right? Myasthenia gravis is another one that you may have heard of, right? That's where your body starts, again, making antibodies against your own muscles, all right? So there's a handful of disorders that people might recognize and not realize these are all autoimmune disorders. I think we probably all know at least one person that has one of those things, and probably more than one.
Oh, for sure. Yeah.
Right. Mm-hmm. So it's kind of scary, because the problem is the traditional medical treatment for this, all right, is really a whole lot of nothing. Unfortunately, it's only things that help to try to control the symptoms. In the medical arena, there is no known cause and no known cure for autoimmune disorders, right? And I don't agree. I'm sorry to say, for them, I don't agree. I'm happy to say, for anybody that wants some help, there actually are known causes and there are known things you can do to correct and reverse those causes. So I'm not saying that I'm even treating those diseases, but I can help find the things that can trigger it and help remove those so that your body that knows how to heal itself can go to work. And I've seen it over and over, right? So the traditional medical treatments are going to be things like steroids predominantly, right, to reduce the inflammation. But what happens when you're on steroids for too long? That starts to jack up your immune system in a bad way as well by suppressing it. So you go from overactive to underactive, and now you've got a problem because you're open to infection, right? Your cortisol levels change, your cortisone levels change in your body. It can lead to bone fractures. It can lead to anxiety. It can lead to all kinds of nasty things. And actually, when you're on it too long, your body thinks it's in a massive survival mode, pumping out. When you're on the steroids, it's as if your body's making your own, but thousands of times stronger.
Sure.
So what happens is it starts to look for very rapid sources of energy because it thinks you're constantly in severe fight or flight, that you need your arms and legs to either fight or run. And so it starts robbing any tissue that it can to get that energy source. And ultimately, once it uses up all the sugar in your blood, all the sugars that's been stored in your muscles, all the sugar that's been stored in your liver, it's then going to start to actually eat away at your organs in order to get that energy source. So ultimately, it will destroy you. I actually, growing up, had a cat that died because it was on steroids and it dissolved its organs. Wow. All right. So being on steroids long-term, not a good idea. All right. So we've got to find a better way.
Can I ask you a quick question? Did we talk about rosacea?
So rosacea, no, there's another one, right? There's so many. How do we pick? Right.
Well, it's so interesting because we were talking about, like, I have, if I drink, my cheeks will get very red. And I was told that was rosacea.
Yep.
Is that
right? So it
what I
can
imagine?
be. That may not be rosacea at all. Rosacea is when you get a ruddy complexion of your cheeks and it stays red, usually without an apparent stimulus. Now,
mine probably stays. It probably stays red, I would say. Yeah.
So true rosacea.
But I do drink a lot, so maybe that's why.
That's a topic for another day.
That's a conversation for the therapists when they come.
Right. We're gonna go there.
That's my
That's a
therapist.
different guest.
We'll talk about that next, the next one.
Well, what might be actually happening more so when you drink is alcohol directly affects your hormone balance, especially your estrogen, right? And it can cause estrogen dominance. And so you can go up, then you can spike down. It can go multiple ways, but that can cause a flushing of your skin. Also, it can lead to hot flashes.
Okay. So it might not be autoimmune at all.
Right. That may be a hormone reaction to the alcohol.
It's just curious because we were talking about treatments and then we were talking about eczema. And I was diagnosed with rosacea, not eczema, but it sounds like eczema, like around my nose, whatever. I was given antibiotics and a cream and it didn't work.
Yeah. Surprise, surprise.
And then now you're saying the antibiotics can make it worse, which I think it kind of, So it's just,
unfortunately, a lot of these
what do you do? What do you do?
I'm going to tell you what to do. Don't worry about it.
All right. We
got this. All right.
Let's dig deep.
So I'm going to say, unfortunately, the short-term treatments are really just a Band-Aid. That often lead to bad long-term outcomes because they're not doing anything to really address the underlying causes. They're not really fixing anything. And by their nature, they are starting to create more damage to your gut lining and to the organs and glands that control your immune function, right? So antibiotics and steroids are not a great answer long-term for these conditions. So what are the true causes, right? Well, as we already alluded to, your intestinal health is paramount when it comes to any autoimmune disease. All right. And we've kind of touched on this topic before. So I'm going to go through it kind of lightly. But I know we have other episodes that might dive into this deeper if people go back and look. But when our gut lining becomes irritated or inflamed from ever having antibiotics, drinking too much alcohol, ever taking ibuprofen. Anybody here ever take ibuprofen? Ibuprofen is known to erode and damage your gut lining. If you eat grains that are mass produced in this country, wheat, oats, barley, rye, corn chips, these are all sprayed with a chemical called glyphosate, the active ingredient in Roundup. And glyphosate immediately destroys your gut lining when it comes in contact with it. Okay. Now it's on a microscopic level. So it's not like you eat something and go, oh my God, I'm dying. Right. But it slowly creates these excess little pinholes all along. The problem with all this stuff, excess stress produces a lot of cortisol. They'll do it. Cortisone will do it from taking a steroid. So all these things can cause it. If you ever had food poisoning. So think about these things I just said. Who hasn't had one of these things? Right?
Right.
Everybody has, and usually more than one. So the chances are this is going to cause damage to our gut lining. And that damage to our gut lining makes the pores on the skin of your gut get too big, right? So those pores are supposed to be tight, but now they start to spread apart due to damage. Now, when we eat food that's only supposed to be able to get through a tight junction in a tiny minuscule size, now there's a big junction. So before it's fully broken down, the whole particle drops in. When that drops in like that, that stimulates a reaction by the white blood cells that live right there in your gut lining, which is 70% of all the white blood cells in your entire body right there waiting to protect you. Well, when that large food particle drops through those big holes, that's a condition called leaky gut. And that leaky gut then causes the food to stimulate your immune system and create an inflammatory response. So we start developing food sensitivities, right? And then every time we eat that food, not realizing that that's a bad thing for us, it creates more and more inflammation. And when that happens, that inflammation in the gut, because the gut and the skin are really the same tissue, causes inflammation on the outside. So oftentimes we'll see this come up as a rash, as blisters, as pustules, as bleeding. It depends on which disorder you're dealing with, right? So it all starts on the inside and shows up on the outside. Now, it doesn't always show up right away in the skin. It may show up as a thyroid problem, right? Or a pancreas diabetes problem. So how's that happen? Well, you know the old adage, you are what you eat, right? So when we eat that food and it goes through our digestive tract, it ultimately gets broken down to smaller molecules that go out and feed and become part and parcel of our cells. That's what our cells are using to build its tissues, right? The protein structures, the amino acids, the carbohydrates, the fats, these all become our cells, right? So you literally are what you eat. Now, if your immune system doesn't like what you're eating and is attacking it in your gut, but you keep eating, it then basically goes over and pulls the fire alarm and says, hey, everybody, there's a big problem here. I can't control it. I want everybody to be on high alert. I want everybody in the immune system, from white blood cells all the way over to antibodies, right, which are the tanks and jets that come in to cause the major destruction of the bad guys. Well, now they're all on high alert, and they go after anywhere that food became a tissue. So if that ultimately became your thyroid, you develop a thyroid problem. If it became your pancreas, you develop a diabetic problem. If it became your brain, you develop a brain problem, right? So it just depends on where it goes in your body. So this can become all these different autoimmune conditions because it all started here and ended up there, right? So we have to look at what is disturbing the digestive tract as one of the number one things we need to look at. So it's obviously, it can be, when I say digestive tract, I really mean intestinal tract, because the intestinal tract has multiple purposes. Digestion is just one of them. As we just discussed, immune function is one of them. Hormone creation and balance is one of them, right? Neurotransmitter function, hormones in your brain, is another one. So this is all controlled by your gut. So if your gut gets disturbed, digestively, it creates inflammation. Immunologically, it creates inflammation. it creates hormone imbalance that creates things like flushing and ruddy complexion. So could that be rosacea? Yes. But if you only see it when you drink and then it goes away, it might be also just directly hormone alcohol related, or it could be alcohol disturbing your gut lining, hormone related. A little tough to tell just based on what you're stating, although true rosacea doesn't come and go quickly, right? Like you're red 90% of the time, not 10% of the time.
So I'm always red, but it gets redder.
Okay.
You know.
So I'm looking at you now, and you don't look particularly red to me. Now,
right. Dude, I covered up.
Okay. All right. You might be tricking me, right?
I'm totally tricking you.
That's so.
But I may have had some wine last night.
Okay. So you still. I
think it might be a combo platter.
Right. It can be.
Yeah.
Right.
Yeah.
So this is where it all really starts. And so when I deal with someone with autoimmunity, I'm always looking not only at their cells themselves, but at the function of their intestinal tract, right? You've got to. If you don't, you're missing a big, big piece of the puzzle. Now, I said I also look at their cells, right? Because each individual cell can be affected that triggers an autoimmune response when it doesn't respond properly to immune signals. And those immune signals are triggering antenna on the surface of the cell called receptors. And those receptors can be damaged not only by inflammatory processes, but a lot by toxic processes, right? So we're ingesting toxins all the time in our air, our food, our water. There are over 145,000 known man-made chemicals in the environment today. About 2,000 more are added almost weekly. And the EPA only tests a handful, like 5 or less per year. So almost all of these drugs and chemicals and things we're exposed to have never been tested for safety. Yet we do know that some of them are known, immune damagers, right? And endocrine mimickers. So a lot of these toxins are going to screw up your hormones. They're going to screw up your immune reactions. They're going to screw up your nerve function. And they all do it by first starting with damage at the cell level. So I always test cell function for receptor function. There's a blood test for that. It's a simple finger prick blood test, right? But if someone has true autoimmune dysfunction, I go much deeper than that because you really need to evaluate all of the most common toxic influences from metals, mercury, lead, arsenic, cadmium, right? To molds and mycotoxins that we're all exposed to the most common chemicals in the environment, the phthalates, the benzenes, right? All these different things that are all around us. Just as a quick example, right? Let's talk about BPA or bisphenol A. BPA is basically a chemical that's used as a plasticizer. So you see it almost all the time in plastics, but it's very damaging to your immune system and to your hormone system. So some places that you wouldn't expect this are the lining of cans, right? So if you're pouring out that can of organic beans, if that can's lined with BPA, guess what? You got a problem.
It's no longer organic, is it?
Right. Now, also
water,
right along those same lines as BPA and other things that are lining items, pizza boxes, right, are lined with a clear, you don't often see it. Sometimes it look a little shiny, but sometimes it look just like cardboard, but it's a clear coat of these plasticizers to keep the heat in the box and prevent the oil from coming through so easily, right? And then heat and cold make it leach out even faster. So it's in the delivery box. It's in the wrappers of, you ever get like a sub or whatever you call it where you are? I grew up in New York, we call them heroes. Down here, they call them subs, So
it's like waxy paper.
Yeah, the wax paper, right?
The wax paper. Is that what wax? Is that what the wax paper is made out of?
Yep. Right.
What?
So, and also, you may have heard of Kerrygold butter, right?
We don't even think about it, right? We don't. It's paper. Right? It's not plastic, and it has wax on it.
You don't realize.
We don't think about it.
Dangerous toxins.
Oh my goodness. Okay.
I used to always recommend people use Kerrygold butter because it was grass-fed butter from Ireland.
Yeah, I use it.
They just got pulled because they found that their wrappers all contained these plasticizing agents that were damaging your endocrine system.
I think I have it in my fridge right now.
Right? What the hell? Seriously?
What?
Right now, do they really not know better? Or are they just cutting corners? I don't know. Right? But it's frustrating. But one very little known area where you come in contact with these chemicals is in thermal receipt paper. Do you ever get a receipt that pumps out that little machine? They rip it off and hand it to you? Well, when you touch that, you're absorbing those chemicals, especially the BPA, within seconds. They've done tests where they literally put a needle in someone's arm, like right here, and then took a blood test, then put the paper in their hand, and 5 seconds later took a blood test, and it was already in their bloodstream.
What?
Yep. Like that, right? And it's so bad and can cause so much hormone disruption that for a while, there was actually an announcement that went out in the retail industry to not let pregnant employees handle cash register receipts because they may miscarry. And they hand to you, and you hold it in your hand, stuff it in your pocket, put it in your bag, wherever you're going to do with it. But we're being poisoned, right? So I was just using that as an example that these things are around us all the time. If you think you're going to not come in contact with a poison, you're absolutely wrong. I'm sorry, right? If you have carpet in your house, if you have painted walls, if you have wood flooring, all these things off gas, right? Mattresses off gas, unless you have an organic latex mattress or organic type of foam mattress. There's crazy amounts of toxins in our environment, on our clothes, all kinds of flame retardant stuff, extremely damaging to your immune system, right? There's a big class action lawsuit of firefighters because all of their outfits are flame retardant, and they're all dying of cancer because these flame retardants cause cancer, right? So they're saving people and dying from their own clothing. But think about, what do you put your kids in? Their pajamas? Are they flame retardant pajamas? You're inviting cancer, okay? Your mattresses are almost always covered and sprayed in a flame retardant chemical. So just laying on them, right? I recommend a particular kind of mattress that I can write a letter, and the company makes them one at a time per order. And because of my letter, they will not include those chemicals on there, right? So that makes me feel safer for myself and for my patients who ask me to buy them for them, but we can do that, right? So these chemicals are everywhere. So not to put you down and make you dismal and think, oh my God, what do I do? Well, what you do is you become aware, right? And you try to eat organic foods so we get away from the chemicals. Make sure that you have purification systems on your water, especially things like reverse osmosis, so you're not getting all the chemicals out of your tap water. Just the other day, the Environmental Working Group, EWG, puts out, you may have heard them, they do the Dirty Dozen and Clean 15 every year, which are the dirtiest, most chemical-laden foods, which are the cleanest. But they also have, right on their website, you can put in your zip code, and they'll tell you what chemicals are in your tap water, right? And I just did that the other day, and there were 16 known volatile chemicals in my tap water right here. And some of them had 800 times the allowable amount that the government says is okay in cancer-causing agents. So am I going to drink that water out of my tap? No, right? Because do you think that might create a disruption to my immune system? You think autoimmune dysfunction might be the least of my worries, right? So what do we do about it? Well, we take the measures to be cautious when we can, but we also should very distinctly put our body through better detoxification protocols, right? So one thing you have to do is find out, is it present? Is this what's causing it? And if it is, let's go through an appropriate detoxification protocol to help my body get rid of the poisons that don't belong there before they have a chance to trigger this cellular damage and this body-wide inflammatory process that can lead to all these autoimmune disorders, right? So I created something called my complete cellular detoxification protocol. And because it is very complete, right? It's a minimum 8-week process of strengthening, preparing the organs and glands of elimination, which are your liver, kidneys, intestines again, blood, lymph, lungs, skin, all these things are getting the stuff out. You got to support them and get them ready for the flushing of the toilets, right?
Right.
Then the next step is drain the toxins out of your body cells, then the next step is body and brain, because a lot of these things get deeply embedded in areas that your juice cleanse simply is not getting it out, right? And I know we did a whole episode on detox where we discussed this in more detail, so I won't keep going into that. We'll just defer back to tell people, check out that episode.
That was a good episode too,
Yeah.
because there are a lot of people claiming that their magic potion will detox you.
Right. And it's upsetting to me because I know better, but very few people do. Right. So they get lured into the latest internet fad of, just drink lemon water in the morning and all your problems will be solved. I'm not saying lemon water is bad, but if you're putting it in the water in your tap, guess what? Lemon ain't cutting it, folks. Right. Yeah. So, there's a lot of things I see done that are very half-assed, really, and they're more dangerous than they are helpful. A lot of these things will stir up the toxins, but not be strong enough to actually capture them and draw them out. So now you're just recirculating stuff that your body tried to store away to keep you safe, and now you took it out of hiding, and now you got a bigger problem, right? That's why people tell me, oh, I did a detox, and I felt horrible. I was fatigued. Had chronic diarrhea. Well, guess what? That means that your body is not actually handling all these toxins that you just kicked out, right? So there are much safer ways to do this. They have to be done slowly, okay? So that you don't threaten the body with the removal of these toxins. It has to be piece by piece. So they're drawn out of your fat cells. They're drawn out of your bone. They're drawn out of your brain. They're drawn out of the places, your heart, your kidneys, your liver, all these places where your body tends to store these toxins away, which are in fatty tissues, in bone again. So it depends on the different type of toxin will get stored in different places. Your body's doing that so it's not actively available to damage your organs and to damage your blood vessels, right? And to damage your nerves, which is helpful in the short run. But again, if you don't get them out at some point, they're going to come out, right? And they're going to rob you of your health. So real important to take the appropriate steps. And a lot of people say to me, well, how do I know if my cells are inflamed or toxic? Maybe without doing, what could turn out to be expensive testing, right? Is there any way of finding out at all if this is remotely possibly going on? So for that reason, I created 2 really easy to follow and easy to do quizzes online. And they're both available right there, drwildcanhelp.com, right? So they're both available right there. If you go there, you'll see, if you go down my website, you'll see a red box that says, or a red button that says, take our cellular inflammation quiz. And you'll see an orange to brown one that says, take our cell toxicity quiz. And these are helping you identify the most common symptoms and areas of exposure related to being overly inflamed or being overly toxic, which, as we just discussed, will trigger damage to your cells and your intestinal system, which will ultimately lead to these autoimmune conditions. So when you take those quizzes, it takes you 5 to 10 minutes to do. There's no strings attached. I even put a key right there. It does the math for you. You don't even have to add up. It tabulates it for you and says, if you're here, you're mild, here, you're moderate, here, you're severe. And if you're here, you might want to consider doing this, or doing this. And then I always invite you to reach out for what I call a free discovery call, that if you want me to go over it with you, I'll take 10 minutes to do that. No charge. It's very easy for me to do that. And I would just love to help you understand what's going on and the best ways to help yourself.
Yeah. You've helped me so much. You helped me with my thyroid. We always talk about that, but it really was terrifying to me that a doctor wanted to remove my thyroid and it was like inconclusive results.
Yeah.
And I was like, what? It's inconclusive, but just on the safe side, we're going to take out your thyroid.
That to me is pretty scary, right? Because your thyroid...
No, like schedule your appointment, like go to the desk and schedule it. And I'm like, no, I think I'm all set. I'm going to go talk to somebody else about that.
Your thyroid's
and now it's great. Yeah. I've got to go back. I think for another ultrasound in April, just to make sure. But we went from surgery to just monitoring it once a year.
Right.
So I
just
feel
by following
like
right steps, right?
Yeah.
Finding out what was creating irritation in your body that was causing inflammation to your thyroid tissue. which was creating nodules, right?
Mm-hmm.
And so just
yeah,
by
it was enlarged.
that,
Yeah.
right?
And another thing too, we're not allowed to talk about certain things, but I did read somewhere recently that a certain virus could aggravate your thyroid.
Yes, right.
And I had it twice around that time.
And that's in part because we hear about a longer version of that.
Yeah.
That doesn't seem to fade away so quickly. People have residual problems, and they're trying to figure out, well, why is that in some people, not in others? And one thing they figured out is because of the organs and glands that seem to be involved in this, that it seems to be that that particular virus stimulates damage to your vagus nerve. And your vagus nerve, vagus in Latin means wanderer. And so it wanders from your brain down throughout your body and attaches to all of your major organs and glands, particularly things like your digestive system and your spleen for immune function, your diaphragm for proper breathing, and your heart, right? All the way up, back up to your brain, even to your sexual organs, right? Your ovaries and your testes. So they have found a correlation with that particular virus, that there can be problems with your heart. There can be problems with your brain. There can be problems with your lungs, right? And breathing. So they figured out that they think it's actually because it's going through the vagus nerve and causing damage to your own nervous system's ability to control those organs and glands, which then leads to an immune stimulation that creates problems there, right? So yes, that could be involved. That can be related because it does also affect your thyroid.
Well, it was just interesting timing, but then, we made changes in my diet and it all piped down. It all came, everything piped down and went back to normal. So.
Right. So even if you are suffering from that long version of a virus, there are things you can do to control that immune system's reaction, right? And help to, reset what has gone wrong.
Right. And that was eliminating sugar, carbs, cutting back on carbs, or eliminating them really for a little bit of time.
Yeah.
But it worked.
Absolutely. And carbs aren't evil, but what we get fed as carbs is a lot of really simple, refined carbs with no fiber, tremendous amounts of sugar. Your body doesn't know how to handle that. That is completely unnatural. There's nothing in the world that grows that is like that. This is all man-made, highly processed, highly refined stuff, right? And even when we think we're getting something good, it's been refined, right? So if you're thinking, well, I'm eating whole grain bread. Well, just the fact that it looks like a slice of bread means it's been highly processed, right?
Right. It doesn't look like a piece of wheat.
Right. Okay. So,
yeah.
And in that processing, they've actually stripped out the vast majority of the nutrients and the fiber and other things. And then they try to add it back in a chemical form after the fact for like 8 cents worth of vitamins. And I'm sorry to tell you, but your body doesn't treat it the same way.
Yeah, no, of course not.
It just doesn't work that way. It's just not, unfortunately, you have to eat real food. Okay. And real food means things that grew in the ground in their natural form, right? Or I am a meat eater, so I want animals that have been raised on the food they're supposed to be raised on, right? On grass and on flowers and on things like that, right? Not on man-made grains treated with glyphosate and made with severe, highly amounts of sugar to fatten the animal up, right? So that's great for the food industry for their sales, but it's horrible for you.
Exactly.
So we got to try to be aware of what we're putting in our mouths. As I always say, the most effective tool you have in your toolbox for health is your fork, right? Because when you take a bite of food, you are doing one of two things. You're either helping to cure yourself or you're helping to kill yourself. Those are your options. There really isn't a neutral. Okay.
Right.
So either this food that's going in is helping to cure by creating new, healthier tissue to regenerate old cells that are dying off, or it's creating an inflammatory toxic process that's destroying more cells. All right. And we're not all perfect. And I don't mean it to be perfect all the time. I mean, let's be realistic.
No, you just, had a good time over the holidays, right?
Right.
We were talking about that. That's exactly how we started the show.
Right. And like I said, I do that because I train for that. I train for that event. right?
Right.
So if I'm going to New York to visit family around the holidays,
Yeah,
do I
right.
want, pizza and bagels and Italian pastries? Of course I do, right?
Oh man,
So,
you must have really not felt well.
oh, I didn't. I didn't. I mean,
Oh
my
my
whole drive
goodness.
home was miserable, right? And
Yeah.
what's really amazing to me is I actually don't eat a lot when I'm there. I just eat a lot. I eat these little things, but I don't eat a lot, right? When at home, I eat a lot. I really do, right?
Okay.
So I usually only eat 1 or 2 meals a day, but when I eat those 1 or 2 meals, it's usually 2 or 3 full plates,
Okay.
right? So I eat a lot of caloric intake, but I eat healthy foods. So my body is used to that, and my hormone balance is used to that. My immune system is used to that. When I go to New York and I say, okay, well, I'm going to have that 1 slice of pizza for lunch. That's not a lot, right? Or I'm going to have that sesame bagel with cream cheese for breakfast. That's not a lot. It's a single bagel. I'm not going crazy, right? Well, my body immediately switches modes. It goes into inflammation mode. And in inflammation mode, my hormones shift. When my hormones shift, I go into water retention mode and I go into dry eye mode. I have an eye condition that you might remember me talking about. I got glass in my eye when I was 2. So I had a corneal transplant when I was 2 that came from an 80-year-old man. And now I'm 55. So that's like 133 years old or something like that. And so that cornea is my weak link. That tissue is pretty much reaching the end of its life expectancy. And so when the eye doctor looks at it, he goes, wow, that is really dry. It's really pitted, right? I'm not sure how much longer it's going to last. And I can thank my healthy lifestyle for making it last as long as it has, because they said the average corneal transplant will last 10 years. So I should have had 5 by now.
Wow.
And I'm still at 1, right?
Mm-hmm.
But when I eat like that, my eye really starts to hurt and act up. It feels like someone's just poking me in the eye, right? So that whole drive home, I'll be like rubbing my eye. I'm like, why did I do this again? Because it tastes good. That's why.
Mm-hmm.
Right? So I put myself through that. But as soon as I get home, right back on track. So within a couple of days, that can go away. Mm-hmm. Right? So I know some people may say, well, you're just being stupid. You should never do that. And it's true. I shouldn't. But I'm also human. We all are. Right? And if I had to be perfect all the time, just shoot me, right? I don't want to be perfect all the time, but I should be perfect most of the time, or at least strive towards perfection. No one's perfect. Strive towards perfection. Strive towards doing the right thing. Make the lesser of the evil choices.
Mm-hmm. Right? So we have about 5 minutes, Michael. Let's talk about what people will find when they go to drwildcanhelp.com.
All righty. So when you go to drwildcanhelp.com, you will find that the first page is explaining a lot about why I do what I do. Because I think it's really important for people to understand my background and what drives me and why I'm so passionate about you doing the right thing. And as I say, I'm trying to help you save your cells so you can save yourselves, right? And the reason I do that is because I lost my wife to a very aggressive cancer. And that was a devastating time in my life. And I tell the story there because I think it's important for you to know. I don't get into all the gory details because I wouldn't be able to handle writing it. Okay. But with what she went through, she was given 2 months to live. And following what we did for her, she lived 3.5 years, 15 times longer than the top oncologist in her kind of cancer ever said she would. So I take that, as I say, that's my little victory. And my bigger victory is now helping people save themselves before they get in a situation, right? Yeah. So she developed that cancer because of a medical treatment, which is a whole other topic we won't get into right now, okay? Yeah. But I tried to help her the best I could to improve the quality and quantity of her life. So that's what I'm about, right? I'm about improving the quality and quantity of your life, particularly with reversing chronic cellular diseases and dysfunction. And the top 5 conditions that kill most people in this country: cardiovascular disease, heart disease and stroke, diabetes, dementia and Alzheimer's, cancer of any kind, and over 150 autoimmune conditions are all related to that same chronic cellular dysfunction and dysregulation that's caused by a couple of very important things: chronic inflammation and chronic toxicity. So if you can figure out what's causing it and best determine how to fix it and how to repair and reverse it, you can overcome the vast majority of those conditions. Even though you may have been told that there is no cure and that there is no hope for you, I strongly disagree. Your body can cure itself if given the right opportunity. I've seen it over and over again.
And what I love about the options you give that are different from our medical system is that you have tests that anyone can take to get a customized approach, because we're all different and we all have different issues. And you have tests that can actually identify everything that's going on in your body, and they're affordable. Can you talk a little bit about that?
That's exactly what I was getting into. Is I'm going to say, can I promise?
Sorry, I have to say stuff occasionally. Occasionally, I have to pipe in
because I do suffer from verbal diarrhea, and I'll just keep going.
I know I should go like this.
Right, but look, you might not be able to tell that because we're looking reverse, but you're on my blind side. So when you do that, I can't see you if you do that. Right?
Oh, so I have to. What do I have to do?
Yeah, so if you do that back and forth like that, I just
everyone, if I go like this, that means Michael needs to let me pipe in.
Right. So sorry about that. You may have been trying to get my attention for all these episodes. I never knew it.
I have been. I'm like, wow, Michael, do you just I'm like raising my hand. No,
I'm sorry.
No, I'm kidding. I just interrupt you sometimes because that's my only prayer. Yeah, it's all right. I don't need you. You're great. People love to listen to you. I don't have anything to say. I'm listening just like everybody else.
Well, I hope that people enjoy what I'm teaching, and I hope that they get some information they take action from, because information without action is really not very helpful, right? So the old adage that knowledge is power is not true at all. Knowledge plus action is power, right? So what you were just talking about is if you need to find out what's going on with you, you have to take the action of finding out what the right tests are and then getting the right kind of doctor to get those tests done for you. And those tests are not commonly done in the medical arena. 99% of the time, they're not done, right? So it's very frustrating to me when someone tells me, my doctor said my tests were normal. I said, let me see what tests were done. Not the right test. Let's put it that way, okay? Not anything's going to give us actionable information about actually healing that person. So what I was trying to say before is, can I promise you that you will cure all your conditions or that I will cure you? Absolutely not. I can't promise that. No one can promise that, right? I can't cure anybody. I always say mankind has not been able to cure anything, not even a ham, properly, right? So it's your body that can cure you, right? Your body was born with an innate healing ability that can control and coordinate the healing repair of all of your tissues as long as the roadblocks are removed, right? So what I do is I'm an investigator. I come in, I look for the roadblocks, I find them, and then I remove them for you. So your body's own innate, inborn, God-given healing ability can do its job. So only you can cure you, right? And I'm not particularly religious, but I think I am spiritual. And I do believe that there's a higher power that our bodies are imbued with when we're born that helps our body heal, right? So I think you got it in you. You just got to get the garbage out of the way. And as human beings, we're really good at piling up the garbage.
And your tests are very affordable. They start at how much do they start at?
So that finger prick blood test I was talking about, right? That is $199 for the test and my interpretation and my coaching you through how to repair anything that's wrong, right? So it's a test and a 30-minute one-on-one consultation with me, just like we're doing right here. So I can do that with anyone literally around the country, and I have patients all around the country who are doing that. So it can start with as little as that.
And you mail, the tests get mailed to you. I've taken a bunch of them. They get mailed to you. You can do them in the privacy of your own home. And the ones that you also, some of them are, actual blood tests.
Correct.
Depending on.
For those, I can send you to a local LabCorp, or if it's a specialty lab that LabCorp can't draw for, we'll find a phlebotomy station for you to go to, or have a mobile phlebotomist come to you.
Yeah. No, it's worked really well. You've helped me with so many things through the years. I mean, we've been working together for a couple of years now, I think, right?
Yeah.
Yeah, I've had you on Vetox for I think 2 years.
Yeah, I think this is actually episode, I think 16. But we
Oh,
didn't have those 3 or 4 months we missed. So
yeah,
that's about 2
right.
years.
We've had 16 episodes. Have we really?
Yeah, I think so. Close to it, if not.
That's funny.
Right. So yeah, we mail them all out to you. You
Mm.
do everything in the comfort of your own home.
Yeah.
And then we get together and explain exactly what it revealed and
Mhm.
exactly how to fix it step by step. Right. And
Yeah.
that is actually all part of my online functional medicine program called Restore Your Health Online. So if you go to drwildcanhelp.com and then you go to the menu, you'll see programs. And under the programs, you'll see Restore Your Health Online. When you click on that, that explains my online functional medicine programs. There are 3 main categories that I offer, and they start as little as $47 a month. All right. Come on, seriously. $47 a month. So in that, you can see more about what I do, how I do it, why I do it, what's important. And it breaks it all down for you. There's lots of information on that page. And then again, I encourage people, if they have any questions, go ahead and book a free discovery call with me. And I'll take 10 minutes to go over it with you and find out if I think I really can help you. Because if I don't think I can, I'm certainly not going to waste your time. Right. But I'll tell you, it's pretty few and far between that I'm not able to help someone.
Right.
Which is why I call my website Dr. Wild Can Help. Right. Because I'm not trying to pat myself on the back, but I do know that as human beings, we all have cells, and cells operate a certain way. And when you repair those cells, they also operate a certain way to heal your body.
Mm-hmm. Well, my friend, we're coming up on the hour. So I think we're going to have to sign off. Where's my little puppy?
He's asleep. He's sound asleep.
Oh, all right.
I've been petting him, stroking him here, and he's out cold.
Oh, he's so cute. All right. So if you would like to reach out to Michael, just go to drwildcanhelp.com and click on free consult.
Yep. It's a free discovery call, and take those quizzes.
Yeah.
You got nothing to lose. Just scroll down the page, take the inflammation quiz, take the toxicity quiz. And if you want to, you can hit submit. It'll send it to me. One of my staff members will reach out to you and ask if you'd like a free call for me to go over it with you.
Yeah. I highly recommend it, you guys, because he's helped me, as I said, so much, and I wouldn't endorse this man if I didn't think he was worth listening to. 100%.
Well, I appreciate that. Thank you very much.
We got to think of another show for March.
All right.
Yeah. So we've got a few.
Power towards that.
Put some brain power towards that. Take care, my friend.
Have a wonderful evening.
All right. You have a wonderful evening as well.
Bye-bye.
Okay. Bye-bye. All right, everybody. Thank you so much for tuning in this evening with Dr. Michael Wild as we talked about autoimmunity, specifically how it's related to skin disorders. I really appreciate it. Our next show, I believe, is March 7th. We will have our psychotherapists on, Brianne Leankamp and Hannah Chapman. They are new to the Vetox family. We had them on Valentine's Day. We had a Galentine's affair, and we talked a lot about anxiety surrounding the Valentine's Day holiday. I was very excited because they're brand new, and we had 9.5 thousand views. So people really liked chatting with us that night. So please tune in on March 7th, and we will be back. We are actually going to be speaking about postpartum depression and postpartum psychosis. So it's going to be an interesting evening. Please tune in, and we will see you then. All right. Thank you, everybody. Have a good evening. Take care. Bye.